Epistaxis. Epistaxis is otherwise known as nosebleed. Nosebleeds occur more often in dry, cold climates during winter month. Causes for epistaxis: rupture in the blood vessel. High BP may contribute to bleeding, hole in the nasal septum, presence of foreign body in the nose, use of blood thinning medications, inflammatory diseases, allergic rhinitis, nose picking, hormonal changes during pregnancy, nasal and sinus infections, mucosal irritations, alcohol abuse, nasal surgery, tumors and inherited bleeding, exposure to warm, dry air for a long period of time, vigorous nose blowing. These are all for the causes for the epistaxis. Epistaxis more commonly occur in elderly people. Epistaxis is separated into two types, where it origins comes from: anterior epistaxis and posterior epistaxis. Anterior epistaxis originates from the front of the nose. It is easily controllable and manageable. It is more common, less significant, and it is more common in the younger patient due to the mucosal dryness and foreign picking. Posterior epistaxis originate from an artery in the back part of the nose. It is less common, and it is occur mostly common in the older patient and hypertensive patient. It is more significant. Then signs and symptoms of the epistaxis: bleeding from the nostril, heavy bleeding. Blood can overflow into the nasopharynx, leads to excessive blood loss, leads to dizziness, fainting and weakness. Diagnosis for this nose bleeding: ENT, medical history, nasal speculum. It is an instrument to diagnose the site of the bleeding, and blood count test. Treatment for the epistaxis: cauterize with chemical called silver nitrate, called chemical cauterization. In more severe cases, nasal packing needed. In child, picking his nose, bleeding from the anterior septum, local pressure and phenylephrine spray will save the day. If it is severe, anterior packing is needed. Youth or young adult gives cocaine. Posterior packing: young adult, juvenile nasopharyngeal angiofibroma, needs to be surgical resection. Elderly hypertensive patients, huge amount of bleeding occurred. These patients mainly require for BP controlling and posterior packing and vessel ligation.